gentlemen, I am Dr. Elise, your personal sexual health advisor. Alright, let's be honest. Things start off great in the bedroom. You're feeling confident. She's into it. And then a few minutes in, your erection starts fading. Suddenly, you're embarrassed, frustrated, maybe even hopeless. If that sounds familiar, stick with me because not only is this problem far more common than you think, it's also fixable. In fact, today I'm going to walk you through the 8 biggest reasons men lose their erections during sex, and most importantly, how to solve each one step by step. But before we dive in, let me quickly ask, where are you watching from? Drop it in the comments below. I love seeing the community grow worldwide. And if you want more evidence-based advice on men's health and performance, make sure to hit subscribe and tap that notification bell. Now, here's the first thing you need to hear. Losing your erection during sex does not mean you're broken. It doesn't mean you're less of a man, and it doesn't mean intimacy is over for you. The truth is, erections are complicated. They are not just about desire. They are the result of a delicate balance between your blood vessels, nerves, hormones, and even your state of mind. And if one piece of that puzzle slips, the whole structure can wobble. So, instead of blaming yourself, let's understand the real reasons this happens and then fix them. If we haven't met before, I'm Dr. Elise. I'm a board-certified urologist, and for the last 5 years I've specialized in helping men protect the prostate, boost performance, and regain their confidence in the bedroom. And let me reassure you, I see men of all ages struggle with this exact issue. From guys in their 30s worried it's happening too soon to men in their 60s who just want to stay strong for the woman they love. The good news, with the right approach, most men can see real improvement. Sometimes in days, sometimes in weeks. Alright, let's be honest. Things start off great in the bedroom. You're feeling confident. She's into it. And then a few minutes in, your reason number 1, gravity is working against you. Most guys don't realize this, but the position you're in matters a lot. From a circulation perspective, if you're flat on your back and your partner is on top, gravity can actually pull blood away from the penis. And if you already have what we call venous leakage, where blood escapes too quickly from the erectile chambers, the problem gets worse. Biology, the veins in your penis are supposed to clamp down and trap blood. If they don't seal well, gravity helps pull that blood right back out. Emotionally, you might feel confused. Why am I losing firmness even though I'm turned on? Practically, change the angle. Positions like kneeling, standing, or having her lie down with you on top. Let gravity work for you instead of against you. Reason number 2, psychological stress and mental distraction. Your brain is the most important sexual organ you've got. If you're stuck in your head, am I doing this right? What if I lose it again? You activate your sympathetic nervous system, the fight or flight branch. That's the exact opposite of what your body needs for sex. Biology, erections require the rest and digest system called the parasympathetic. Stress hormones like adrenaline tighten blood vessels and shut the erection down. Emotionally, this is where embarrassment compounds itself. Once it happens, you're more likely to fear it happening again. Practically, try slowing down. Focus on your partner's breathing, her sounds, the feel of her body. Staying present in the moment is a powerful antidote to anxiety. Reason number 3, decreased penile sensitivity with age. As we get older, the nerve endings in the penis simply become less responsive. Add in diabetes, cardiovascular disease, or even years of friction, and sensitivity can drop by 30% or more by your 60s. Biology, less nerve signaling means weaker arousal signals to the brain. Less feedback equals weaker erections. Emotionally, it can feel like you're doing all the right moves but not feeling much in return. Practically, devices that provide gentle vibration, testosterone optimization, and boosting nitric oxide levels can reawaken sensitivity over time. Reason number 4, insufficient arousal. Sometimes it's not that your body can't stay hard, it's that your mind isn't fully there. Biology, without full arousal, your brain doesn't send strong enough signals through the pelvic nerves. Blood flow is weaker and the erection softens. Emotionally, this often happens when there's stress in the relationship or distractions in the environment. Practically, don't rush. Spend more time in foreplay, tease, kiss, explore. If your partner is aroused and engaged, your own arousal deepens naturally. Reason number 5, performance anxiety becomes a self-fulfilling prophecy. One bad experience can trigger a cycle. You worry about losing your erection, which activates stress hormones, which causes you to lose your erection again. Biology, adrenaline spikes. Parasympathetic activity crashes. Blood drains from the penis. Emotionally, each episode chips away at confidence, making intimacy feel more like a test than a pleasure. Practically, reset the script. Focus on giving, not proving. Oral sex, sensual touch, and massage take the pressure off and often bring erections back naturally. Reason number 6, cardiovascular and vascular health issues. Erections are a vascular event. They depend on healthy arteries and veins. High blood pressure, high cholesterol, diabetes, and smoking all damage the delicate lining of your blood vessels. In fact, erectile dysfunction is often the first sign of heart disease, showing up 3 to 5 years before a cardiac event. Biology, narrowed arteries mean weaker blood flow to the corpora, the erectile chambers. Emotionally, it feels unfair. You want intimacy, but your body doesn't cooperate. Practically, this is a red flag to see your doctor. Improving heart health through exercise, diet, and quitting smoking directly improves erections. 2. Reason number 7, hormonal imbalances, especially low testosterone. Testosterone fuels libido, penile sensitivity, and even nitric oxide production. After age 30, levels drop about 1% each year. Biology, low testosterone means weaker erections, less desire, and slower recovery between sessions. Emotionally, men often describe it as feeling flat, not just sexually, but in mood and energy, too. Practically, get your testosterone checked. Sometimes lifestyle changes are enough. Sometimes medical treatment is needed, but you won't know until you measure. Reason number 8, lifestyle factors you overlook. Alcohol, poor sleep, dehydration, even a full bladder. These little details have a big impact. Biology, alcohol depresses your nervous system. A full bladder compresses pelvic nerves. Poor sleep throws off testosterone. Emotionally, these are the most frustrating cases because you could have avoided them. Practically, empty your bladder, hydrate, go easy on alcohol, and prioritize rest before sex. Simple fixes, big payoffs. Now that you understand the top 8 reasons, let's talk solutions. Here are the fastest, evidence-based fixes my patients use. Empty your bladder before intimacy. Use gravity-friendly positions. Extend foreplay for both partners. Skip alcohol on nights you want peak performance. Space out ejaculations. Many men find 7 to 10 days keeps erections stronger. Use a constriction ring if venous leakage is an issue. Support vascular health with supplements like citrulline, pomegranate, or French maritime pine bark extract. Address sensitivity through testosterone optimization, vibration therapy, or circulation support. Small steps, big difference. You are not alone. Millions of men, more than half over 40, experience erectile challenges. But with the right steps, most improve, some dramatically. I've watched patients who thought intimacy was over rediscover passion, closeness, and confidence they hadn't felt in years. Gentlemen, age is not the end of vitality. Erections are about freedom, dignity, and connection. Every small change, walking more, cutting back on alcohol, taking care of your heart, practicing presence, moves you closer to the confident, powerful man you want to be. Take care of yourself. Stay strong. Now that we've covered the most common reasons behind losing an erection, let's dive deeper into how to truly reclaim control and confidence in the bedroom. This isn't about quick fixes or temporary tricks. It's about building a foundation that supports consistent performance, pleasure, and intimacy for years to come. First, let's talk about blood flow and vascular health, because this is the cornerstone of lasting erections. Erections are primarily a vascular event. That means your blood vessels need to be healthy, flexible, and unobstructed. High cholesterol, high blood pressure, diabetes, and smoking don't just affect your heart. They directly impact your ability to maintain firmness. The arteries in the penis are narrower than coronary arteries, so even small blockages can create noticeable problems. If you've ever felt that your erections are softer than they used to be, your vascular health might be silently signaling a larger issue. Here's the empowering part. Lifestyle changes have immediate effects. Regular aerobic exercise like brisk walking, cycling, or swimming improves circulation within weeks. A heart-healthy diet rich in fruits, vegetables, lean protein, and healthy fats not only supports your overall health but strengthens the very blood vessels that fuel erections. And yes, quitting smoking is non-negotiable. Every cigarette constricts blood flow, so reducing or eliminating it has a dramatic impact. Next is stress management and mindset. Your brain is the ultimate sex organ. No matter how strong your body is, if your mind is overloaded, you'll struggle. Stress hormones like cortisol and adrenaline constrict blood vessels and inhibit the parasympathetic system, which is essential for arousal. Mindfulness techniques, even 5 minutes a day, can drastically improve performance. Try focusing on your breath, the sensations in your body, and your partner's responses. Imagine letting go of worry about performance, letting yourself enjoy the moment fully. This mental shift isn't just calming, it actually enhances physiological function. Think of it as training your brain and body to work together rather than against each other. Now, let's talk about the role of testosterone and other hormones. Testosterone isn't just about libido, it influences nerve sensitivity, mood, and the ability to maintain erections. Low levels are incredibly common in men over 40, and the decline is gradual. Often, men don't realize how much it affects their bedroom confidence until levels are checked and optimized. You can support healthy testosterone naturally with resistance training, adequate sleep, stress reduction, and certain nutrients like vitamin D and zinc. In some cases, medically supervised therapy may be necessary, but this should always be done with professional guidance. Another key factor is pelvic floor strength. These muscles, often overlooked, play a critical role in controlling erections and ejaculation. Weak pelvic floor muscles can contribute to venous leakage, where blood escapes the penis too quickly, and also reduce stamina. Simple exercises, sometimes called Kegels, can be done discreetly anywhere. By contracting and holding the muscles you use to stop urination midstream, then relaxing, you train better control. Over time, men report firmer, longer-lasting erections and greater sexual confidence. Let's not forget nutrition and hydration. A well-fueled body performs better across the board. Dehydration alone can reduce blood volume, making erections weaker. Nitric oxide, a molecule critical for blood vessel dilation, can be naturally enhanced by consuming nitrate-rich foods like spinach, beetroot, and arugula. Antioxidants from fruits like berries also protect blood vessels from oxidative stress. Consider small, sustainable changes. Replace sugary drinks with water, incorporate at least one nitrate-rich meal per day, and balance proteins, healthy fats, and complex carbohydrates. Sleep is another silent factor. Poor or insufficient sleep lowers testosterone, increases cortisol, and reduces overall energy. Even 1 week of disrupted sleep can impact erections noticeably. Prioritize 7 to 9 hours of quality sleep. Simple habits like limiting screen time before bed, keeping the bedroom cool, and maintaining a consistent schedule can make a huge difference. Now, let's address psychological intimacy. Performance is one part, but connection is equally important. Men often focus solely on physical mechanics and overlook emotional presence. Being attentive to your partner, noticing her breathing, reactions, and body language, creates a feedback loop that enhances pleasure for both. Emotional connection isn't abstract. It has real physiological effects. Oxytocin, sometimes called the bonding hormone, surges during intimacy, increasing trust, arousal, and the ability to maintain erections. So, paying attention is not just romantic, it's performance-enhancing. Finally, let's consider supplemental support. While lifestyle changes are the foundation, certain natural compounds have been shown to enhance blood flow and sexual stamina safely. Citrulline from watermelon supports nitric oxide production. Pomegranate and French maritime pine bark enhance circulation, and blends like Tonkat Ali, fenugreek, and nettle can support energy, endurance, and testosterone. Always choose high-quality, clinically studied products and discuss with your doctor before starting anything new. Putting it all together, start with lifestyle, exercise, diet, hydration, sleep, and stress management. Support vascular and hormonal health. Strengthen pelvic floor muscles. Prioritize emotional connection and mindful presence in intimacy. Use safe supplements as a complement, not a replacement. This multi-layered approach doesn't just help erections, it improves overall vitality, confidence, and enjoyment of life. Remember, regaining control isn't about instant results. It's about consistent, informed action. Start small. Track improvements. Celebrate progress. Many men see changes in days. Deeper, long-term improvements appear in weeks and months. By addressing body, mind, and lifestyle, you reclaim not just erections, but dignity, confidence, and freedom in your relationships. Gentlemen, your best days in the bedroom are not behind you, they are ahead. With the right knowledge, habits, and mindset, you can rediscover intimacy that is more satisfying, more reliable, and more connected than ever before.